Hello. I recently had the chance to interview a Mayo Clinic Health System patient to discuss her cancer journey. This patient is also a personal friend. It's the story of an extra special graduation day. They say life is made of small moments, but just one moment can change your life forever.
It was about the size of a pineapple. So I remember sitting there thinking, now I know why my right hip hurts, because it's my right ovary. Now I know why my lower back hurts. Now I know why I'm bloated.
At age 52, Michelle Messer was told she had an aggressive form of ovarian cancer. Ovarian is one of the deadliest cancers for women, and there is no reliable diagnostic test to detect the disease in its early stages. When she was diagnosed by gynecologist Dr. Suzette Peltier at Mayo Clinic Health System, Michelle was already stage 4, meaning the cancer had spread.
They knew that it had moved to my liver. It was all over my abdominal cavity, part of my colon, and my lungs.
Michelle's husband, Sean, says the news was devastating.
That was probably the most crushing thing I've ever felt in my life.
That is, before the couple had to break the news to their adult sons and young daughter.
Oh, that was horrible. That was really bad.
And how do you tell a 13-year-old girl that her mother might not be here in a year or 2 years?
So I came home from school, from the bus, and I walked in, and they were both sitting on the couch.
We just sat there, and she came in the door, and her face dropped because she obviously could read our body language.
And I told her that I had cancer, and she started crying, and she said no, and she fell to the ground.
And she let out actually a blood-curdling scream that I've never heard before.
What can you do? The only thing you can do is hug them.
After the initial shock had subsided, the entire family quickly moved into action mode. Within 3 days, Dr. Peltier in Eau Claire, Wisconsin, arranged for Michelle to be seen by specialists at Mayo Clinic in Rochester, Minnesota. After rounds of tests, thoracic surgeon Dr. Francis Nichols performed Michelle's first surgery to remove cancer from her lungs. It was a fearful time, but Michelle and her medical team remained positive.
Having a professional look at you and say, we're going to fight this, and we're going to do everything we can. My surgeon said we're going for the gold. This is the Olympics. I mean, statements like that, when you are so fearful, I mean, that's the only word I was just fearful, are empowering.
2 weeks later, while still recovering from that initial surgery, Michelle underwent a 9-hour abdominal surgery performed by gynecological oncologist Dr. Carrie Langstrot, which included a full hysterectomy. The pineapple-sized tumor was removed, and more.
They removed, my gallbladder was full of cancer, part of my colon, several dozens and dozens of lymph nodes.
Michelle underwent chemotherapy every week for nearly 8 months at Mayo Clinic Health System, close to her home in Eau Claire. It was grueling. She lost her hair, she lost her energy, but she never lost hope. She had many fierce, loyal friends and family serve as her support system, including me.
Kristen, I felt like there was an instant bond, because we both shared the same cancer. And I felt that you knew what that fear was. You were just comforting. It was just nice to know that there was somebody else out there that knew what I was feeling, because you'd gone through it before. And I also realized that I didn't realize how bad it was for you, because until you're there, you don't know. So, yeah. And you're a survivor, so that really helped.
both survivors.
We're both survivors, yeah.
We are sisters in teal.
We are sisters in teal.
You may have noticed the color teal a lot in this story. Teal is the color that represents ovarian cancer. The color permeates Michelle's life, wardrobe, and home. There's no shying away from ovarian cancer, so her family doesn't shy away from the color or educating others about the disease. Michelle went into remission. With stage 4, you're never truly considered cured. Her hair grew back. Then, a year and a half after her initial diagnosis, she felt a lump on her neck. It was a recurrence of the ovarian cancer. That meant more surgery, losing her hair again, and more chemo. This time treatment was much harder on her body, but hope persisted from Michelle and her oncology team.
The really cool thing about Dr. Basu was, every time I had chemo, even though I didn't have an appointment with him, my appointment was, having the chemo, he would swing through and pop his head in my room. It was a tough chemo day. And I looked at him and I smiled and I said, "I'm faking it till I make it." And he looked at me and he kind of cocked his head and he said, "You've already made it." Huge. Huge.
More hope.
More hope.
5 years after her initial diagnosis, Michelle is again in remission, truly living life with stage 4 cancer, and yes, at peace with what may lie ahead. She's requested, if her health should deteriorate in the future, that this video remain available to give others hope. For the first time in 5 years, Michelle had a chance to reconnect with Dr. Peltier and ask to see that initial scan that changed her life. And recalled a shared moment with the doctor in an exam room immediately after learning she had cancer. A moment for which she is forever thankful. What was it like for her to be able to tell you thank you in person?
I'm just probably gonna break down and cry. It's very humbling. Yes. I can't tell you how refreshing it is to see somebody 5 years out from stage 4 ovarian cancer.
I think Mayo Clinic has all the pieces. They have the heart, they have the intelligence, they have the professionalism, they're efficient, but they also have that warmth, that humanness about them. I would highly recommend them. They saved my life.
Michelle is now an active volunteer at Mayo Clinic Health System with her pet therapy dog, Hunter. The pair visits patients and providers in the Cancer Center, a place Michelle knows well, but does not fear. And then did you take part in the bell ceremony here and do something special?
Gotcha.
It's graduation day.
Yes, it is.
A day Michelle wasn't sure she'd ever live to see has arrived. It's now Hannah's turn to graduate. A day filled with varied emotions and a legacy of lessons learned.
I think she's one of the strongest people I've ever met and will ever meet. That she's always looking for the bright side of things. And I think that's part of the reason she's so here.
Hannah Joan Messer.
Graduation day, a mere moment in time for some, the moment of a lifetime for others.